You're watching NorthState Health, the North State's first local health program.
Let's talk about arthritis. You know, that problem. What should people be looking at when they start thinking they may have that? Is that a symptom of all these things?
Arthritis and carpal tunnel, typically different things. One of the most common things I see is arthritis at the bottom of the thumb, or the base of the thumb right in here. And it's something that typically affects women way more than men because they tend to have more ligamentous laxity in their thumbs. And so frequently I'll see patients whose hands look perfectly fine except the thumb, where it's sticking out and it becomes contracted and gets in a little different direction and affects their function.
Okay. We talked right at the top of the segment about, you know, the surgical options, obviously, but there are some non-surgical options as well. So even if somebody comes and, you know, gets checked out and they have some problems, there are some options that maybe they might not have to have surgery?
Sure, and typically when patients come in with any of these conditions, we try to do what we can to avoid surgery, bracing, therapy, steroid injections, things like that, exercises, to try and avoid surgery when at all possible.
Okay, you were talking about when people have, you know, the problem with their thumb, and I mean, obviously that can, you know, impact their lives if they're into, you know, sports, playing music and stuff like that. But yeah, and you've seen some success stories though, very quickly, that, you know, you can treat these problems and they can get back to living their normal lives.
That's true. I have patients who are musicians, for instance, guitarists. They typically they have to bring the hand in a flex position like that, and with carpal tunnel syndrome, it's very impossible or virtually impossible for them to do it for a prolonged period of time. And with things like thumb arthritis, piano players need to stretch their hands to get to the keys, and when the thumb is contracted into the palm, it's pretty difficult to do that. And I've had patients who have shied away from teaching piano or playing piano actively, things they love to do, because of this condition.
Okay, we were talking about the thumb, and then also there's something about contracture. What is that?
The most common contracture I see is entity called Dupuytren's contracture, and it's largely an inherited problem where the skin of the hand gets quite thick and starts drawing in the fingers. And I'll see patients who have a little bit, and I'll see patients who have it all the way down. And typically runs in families, typically on the male side of the family, but we see it in women too.
Okay, so bottom line is there is help out there if people need it.
Yes, there is. There is surgical excision to straighten out the fingers. There's also some newer things out where there's injectables in there that you can put in there, will help melt that tissue that you can manipulate, and try and avoid a big surgery to straighten the hand out.
All right, thank you, Dr. Ferraro.
You're watching NorthState Health, the North State's first local health program.